further 11% in the past week, and deaths have fallen by 17%. But just as the vaccination programme has shifted the odds in our favour, a worrying new variant has always had the opportunity to shift them back. Last week, I was alerted to what is now known as the Omicron Variant, now designated a variant of concern by the World Health Organization. We're learning more about this new variant all the time, but the latest indication is that it spreads very rapidly. It may impact the effectiveness of one of our major treatments for COVID-19, Ronapreve. And, as the Chief Medical Officer said this weekend, there's a reasonable chance that our current vaccines may be impacted. I can update the House that there have now been 5 confirmed cases in England and also 6 confirmed cases in Scotland, and we expect cases to rise over the coming days. The new variant has also been spreading across the world. Confirmed cases have been reported in many countries, including Austria, Belgium, the Czech Republic, Denmark, Germany, Italy, the Netherlands, and Portugal. In this race between the vaccines and the virus, the new variant may have given the virus extra legs. So our strategy is to buy ourselves time and to strengthen our defences while our world-leading scientists learn more about this potential threat. On Friday, I updated the House about the measures we've put in place, including how, within hours, we'd placed 6 countries in southern Africa on the travel red list. Today, Mr. Speaker, I'd like to update the House on more balanced and proportionate steps that we are taking. First, measures at the border to slow the incursion of the variant from abroad. On Saturday, in line with the updated advice from the UK Health Security Agency, we acted quickly to add 4 other countries to the travel red list: Angola, Mozambique, Malawi, and Zambia. This means that anyone who's not a UK or Irish national or resident who's been in any of these countries over the previous 10 days will be refused entry. And those who are allowed entry must isolate in a government-approved facility for 10 days. Beyond this red list, we're also going further to put in place a proportionate testing regime for arrivals from across the world. So we'll require anyone who enters the UK to take a PCR test by the end of their 2nd day after they arrive, and to self-isolate until they receive a negative result. The regulations for this have been laid before the House today and will come into effect at 4 a.m. tomorrow. Second, we've announced measures to slow the spread of the virus here in the UK. We're making changes to our rules on self-isolation for close contacts in England to reflect the greater threat that may be posed by this new variant. So close contacts of anyone who tests positive with a suspected case of Omicron must self-isolate for 10 days, regardless of whether they have been vaccinated or not. Face coverings will also be made compulsory in shops and on public transport in England unless an individual has a medical exemption. The regulations for self-isolation and face coverings have been laid before the House today and will come into force at 4 a.m. tomorrow. But I can confirm to the House that there will be a debate and votes on these 2 measures to give the House the opportunity to have its say and to perform valuable scrutiny. My right honourable friend, the Leader of the House, will be setting out more details shortly and will be reviewing all of these measures that I've set out today after 3 weeks to see whether they are still necessary. Third, Mr. Speaker, we're strengthening the defences we've built against the virus. We're already in a stronger position than we were when we faced the Delta variant. We have a much greater capacity for testing, an enhanced ability for sequencing, and the collective protection that's offered by 114 million jabs in arms. And so I would like to update the House on our vaccination programme as well. Our COVID-19 vaccination programme has been a national success story. We've delivered more booster doses than anywhere else in Europe, and we've given top-up jabs to over 1 in 3 people over the age of 18 across the United Kingdom. I'd like to take this opportunity to pay tribute to the NHS, the volunteers, the armed forces, and everyone else that has been involved in this life-saving work. Our vaccines remain our best line of defense against this virus, in whatever form it attacks us. There's a lot we don't know about how our vaccine responds to this new variant. But although it's possible that they may be less effective, it's highly unlikely they will have no effectiveness at all against serious disease. So it's really important that we get as many jabs in arms as possible. Over the next few weeks, we were already planning to do 6 million booster jabs in England alone. But against this backdrop of this new variant, we want to go further and faster. So I asked the JCVI, the government's independent expert advisors on vaccinations, to urgently review how we could expand the programme and whether we should reduce the gap between second doses and boosters. The JCVI published its advice in the last hour. First, it advised that the minimum dose interval for booster jabs should be halved from 6 months to 3 months. Second, that the booster programme should be expanded to include all remaining adults aged 18 and above. Third, that these boosters should be offered by age group in a descending order to protect those who are most vulnerable to the virus. So priority will be given to older adults and people over 16 who are at risk. Fourth, that severely immunosuppressed people aged 16 or above who've received 3 primary doses should now also be offered a booster dose. Finally, that children aged between 12 and 15 should be given a second dose 12 weeks from the first dose. I have accepted this advice in full. With this new variant on the offensive, these measures will protect more people more quickly and make us better protected as a nation. It represents a huge step up for our vaccination programme, almost doubling the number of people who will be able to get a booster dose to protect themselves and their loved ones. And I know that we are asking more from NHS colleagues who've already given us so much throughout this crisis, but I know that they will be up to the task. The NHS will be calling people forward at the appropriate time so that those who are most vulnerable will be prioritised. And I'll be setting out more details of how we are putting this advice into action in the coming days. Mr. Speaker, our fight against this virus is a global effort, and so I'd like to update the House on the part that the UK is playing. We currently hold the presidency of the G7, and earlier today I convened an urgent meeting of G7 health ministers to coordinate the international response. We were unanimous in our praise for the leadership shown by South Africa, who were so open and transparent about this new variant. And we were resolute in our commitment to working closely with each other, the World Health Organization, and, of course, the wider international community to tackle this common threat. Mr. Speaker, our experience of fighting this virus has shown us that it's best to act decisively and swiftly when we see a potential threat, which is why we're building our defences and putting these measures in place without delay. Scientists are working at speed, at home and abroad, to determine whether this variant is more dangerous. And I can assure the House that if it emerges that this variant is no more dangerous than the Delta variant, then we won't keep measures in place for a day longer than necessary. COVID-19 is not going away. And so we'll have to keep seeing new variants emerge. So if we want to live with the virus for the long term, we must follow the evidence and act in a proportionate and responsible way if a variant has the potential to thwart our progress. And as we do this, we are taking a well-rounded view, looking not just at the impact of these measures of the virus, but the impact to the economy, to education, and non-COVID health, such as mental health. And I'm confident that these responses that we set out today are balanced and responsible steps that are proportionate to the threat that we face. Mr. Speaker, this year, our nation has come so far down our road of recovery, but we always knew that there would be bumps in the road. But this is not a time to waver. It's a time to be vigilant and to think about what each and every one of us can do to slow the spread of this new variant. Getting a jab when the time comes, following the rules that we've put in place, and getting rapid, regular tests. If we all come together once again, then we can keep this virus at bay and protect the progress that we have made. I commend this statement to the House.
Shadow Minister Dr. Rosena Hallen-Khan.
Thank you, Mr. Speaker, and I'd like to start by sending my best wishes to the Shadow Secretary of State, who cannot be here as he is currently off with COVID, and we all hope he gets better soon. I'd like to thank the Secretary of State for advance sight of his statement. This variant is a wake-up call. The pandemic is not over. We need to act with speed to bolster our defences to keep the virus at bay. And it is also an important reminder that no one is safe until all of us are safe. Ministers have not met the commitments that were made this summer at the G7 to get the vaccine rolled out to other parts of the globe. What update can the Secretary of State give on the government's global commitments? And given that Omicron is already here, what we do at home truly matters. There are measures that we can put in place right now to keep infections down and ensure the country has the best possible protection. Can he set out the rationale for not introducing pre-departure testing? Surely this would be an effective way of preventing people travelling with COVID into our country. We support the decision to introduce masks on public transport and in shops, but we believe this should never have been abandoned in the first place. Keeping masks in place would always have been our plan A. Will the Secretary of State extend the use of masks to hospitality and other settings? Or does COVID not spread in pubs? Most importantly, what is the plan to enforce mask wearing? Shop workers have given so much during the last 20 months alongside our emergency services. Asking shop workers to enforce mask wearing is yet another pressure that they do not need and do not deserve. If masks had been mandatory, it would have been harder for this new variant to spread. A global study published in the British Medical Journal argued that face mask wearing can bring transmission down as much as 53%. And this government's flip-flopping on masks has created confusion across schools, colleges and universities. So can the Secretary of State today confirm the new requirements across all education settings? And the Prime Minister is not the best person to tell people to wear masks when he can't even be bothered to wear one himself when he goes into a hospital full of vulnerable patients. And can I ask the Secretary of State when Conservative backbenchers will start wearing their masks? Can the Secretary of State update the House on when he expects there to be a decision on vaccinations for younger children? As the government has fallen far short of its own target to offer all 12 to 15-year-olds the vaccine by October half-term, so can he say what action will be taken to speed up vaccine rollout? Our NHS have done us proud and have done a fantastic job to deliver the vaccine, offering first, second, third and booster jabs all at the same time as treating patients suffering from COVID and trying to recover elective procedures. I'd like to take this time to thank everyone who works in our NHS and care sector, and we're putting even more demands on them at the moment. Our NHS has stepped up to the challenge, and it is a shame that this government simply hasn't done that. Vaccine rates among those with mental illnesses are low and mortality rates high. The government needs to stop weaponising mental health and instead must recognise that good, clear, honest communication is so important in a crisis, something that they have failed to do so far. And I know, and I've mentioned time and time again, but the government must acknowledge the trauma for people with severe COVID, long COVID and NHS staff. So where is their plan? Labour has been clear throughout this pandemic that proper sick pay will help people to isolate. The government has chosen to ignore us time and time again, so I ask again, what support will be available to people who need to self-isolate? And isn't this the time to finally fix sick pay? I would also appreciate it if the Secretary of State could update the House on the new antivirals and how they will be utilised. And why are the government not already giving antibody tests to the immunocompromised? The situation we find ourselves in now was entirely predictable. Yet again, this government have shown they are incapable of protecting our communities, protecting our NHS and saving lives.
So stay.
Thank you, Mr. Speaker. First, can I also extend my best wishes to the Shadow Health Secretary and wish him a speedy recovery. I do have to say, Mr. Speaker, I do think the Honourable Lady has misjudged the tone of the House. This is a very serious matter, and I think the whole country would be looking for all members of this House to work together and to support the nation. And surely she isn't blaming the UK government for the emergence of this new variant. I feel, Mr. Speaker, perhaps she was just auditioning for the reshuffle that's going on in her party right now. But let me, Mr. Speaker, answer the questions around. She asked about international donations. And the UK is leading the world in international donations, quite rightly so. It is absolutely right that that is treated as a priority. We would like to see other countries step up as well. The Prime Minister made a pledge a few months back of 100 million donations by June 2022, 80% of those through COVAX, of which we are a huge supporter, and 20% bilaterally. And so far we have donated over 20 million, more than many other countries. And COVAX, as I said, an organisation we help found and we support, has donated, I believe, some 537 million doses to 144 different countries. The rules, the Honourable Lady asked about the rules on travel and masks and others that I set out. Well, I will say, Mr. Speaker, I think I've addressed that. I do believe that they are proportionate and it's a balanced response. On the vaccine rollout, we've just set out a huge expansion of the vaccine rollout programme. It's a shame that the Honourable Lady could not find it in herself to welcome that vaccine rollout. And as I said, I will set out more details in coming days on exactly how we intend to meet the requirement to vaccinate more. And then on antivirals, we're one of the few countries in the world that have procured the two leading antivirals. We were our regulator, the MHRA, our independent regulator, was the first in the world to approve one of those antivirals. I'm pleased with the over 700,000 courses that we have for citizens across the United Kingdom, but of course, given the emergence of this new variant, we'll be reviewing that and seeing if more needs to be done.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The late Donald Rumsfeld coined the phrase known unknowns, and that is what we face with the new Omicron virus. So the Secretary of State is absolutely right to take sensible and proportionate measures to buy time while we are waiting to understand how dangerous this new variant can be. But does he not agree that the fact that we are facing this danger is also a symptom of the failure of Western countries to make sure that vaccines are distributed adequately around the world? And whilst I recognise the enormous contribution the UK has made through COVAX, through the development of the AstraZeneca vaccine and so on, is it not a moral and practical failure that richer countries have managed to vaccinate 60% of their populations, when for poorer countries it's just 3%?
So stay.
First of all, Mr. Speaker, can I thank my right honourable friend for his support? And I do agree with his words. It is important that all rich countries do everything they can to support vaccines and donations of vaccines to developing countries. I set out earlier what the UK has done, and we can be proud of that, but we do need other countries to set up. In the G7 meeting I chaired earlier today with health ministers, we all agreed of the importance of this and about redoubling efforts to make sure all commitments are met.
SNP spokesperson Richard Thompson.
Thank you, Mr Speaker, and can I thank the Secretary of State for advance sight of his statement, and also add my own thanks to the work that the NHS does and continues to do in all parts of these islands to keep us all healthy and safe. The emergence of Omicron, including the 6 cases that we've seen in Scotland, along with the evidence of community transmission, shows that this is absolutely no time to be complacent. But for all the measures that are being taken now at the border, day 2 PCR testing, because of the incubation period, risks missing a number of these cases passing through the border. And a more effective approach, surely, would be to introduce day 8 PCR testing along with 8 days of isolation to accompany it. And it would surely be better to do that now than to be bounced into that position by events further down the line. Secondly, Mr Speaker, the Secretary of State issues a call for us all to work together, which I'm sure we would all wish to be able to do. But I wonder if he shares my disappointment that when the First Ministers of Scotland and Wales today called for a COBRA meeting to be convened, it appeared to be dismissed out of hand already. So I wonder, will the Secretary of State prevail upon the Prime Minister to call, attend and convene an urgent COBRA meeting involving all 4 nations, so that people might be persuaded that he's on top of this development, as we would all expect him to be? And finally, I wonder, would the Secretary of State agree with the opposition front bench and the Chair of the Select Committee and myself that this emergence of this variant shows that none of us are safe until all of us are safe, and that however much is being done and however much the UK has done to date, more still needs to be done in order to achieve as close to 100% global vaccination as is possible. That not only includes the vaccination programmes that we're in, but it involves increasing global vaccine production as well as overcoming the barriers that patent law might place in the way of achieving that.
Mr Speaker, can I first turn to the honourable gentleman's question around the day 2 testing? We do believe that the day 2 testing requirement is the proportionate response for international travel. He will know that it applies to all incoming arrivals into the UK, and that the individual concerned would have to self-isolate until they get a negative test result. And I think that is the right response. In terms of meetings and UK the nations working together, I think that has been one of the successes of the UK response to this pandemic, the way that the nations across the UK have worked together, especially on vaccines, on testing, on surveillance and antivirals, and it shows that we're stronger together.
Red Clark.
Thank you very much indeed, Mr Speaker. So Andrew Pollard, who developed the Oxford vaccine, predicted to my Select Committee in June that new variants would escape the vaccines by being more infectious, but that protection against severe illness should continue. Yes. So will my right honourable friend avoid taking any panic measures if we see a rise in infections during the weeks ahead, as seems inevitable, and concentrate instead on the vaccine's effectiveness against severe illness and hospitalisation?
Mr Speaker, my right honourable friend is absolutely right. We have already, as I referred to in my statement, even with the dominant Delta variant at the moment, we have seen some rises in infections, but we've been seeing falls in hospitalisation, in death rates, thankfully too. And the reason for that is the power of the vaccines, especially our booster programme, the largest in Europe. So my right honourable friend is absolutely right that what matters as we look ahead around this new variant is what matters more than anything is hospitalisations.
Flyback.
Thank you, Mr Speaker. The second line in the Secretary of State's statement says, "We've always known that a worrying new variant could be a threat to the progress we've made as a nation." With that in mind, does he think it was wrong for the government to abandon mask wearing in public places and confined spaces? And will he listen to the recommendations of Doreen Lawrence's report and start to issue full face protection masks to care workers and health workers?
So State.
Mr Speaker, surely the honourable gentleman isn't suggesting that if we had different rules on masks over the summer, that this new variant would not have emerged?
Andrea Lenson.
Thank you, Mr Speaker. I'm sure my right honourable friend will want to pay tribute to the South African government for raising the existence of the Omicron variant, and obviously that has resulted in them having a travel ban imposed. I do have constituents and in fact family members stuck in South Africa. So can my right honourable friend tell us how long he expects cancellations and suspensions of flights to occur? Because obviously for anyone stuck overseas, it's a very worrying time.
Stay.
First of all, I join my right honourable friend in again expressing thanks to the South African government about how they have handled this difficult situation. And I also understand what my right honourable friend has said about her constituents. Many of us will have constituents in a similar position. And it is hard to say when direct flights might start, but we have started our hotel booking programme, so that is one part of trying to get our citizens back, but we will do everything we can to support them in that way.
Well, Rivals.
Thank you, Mr. Speaker. Can I ask the Secretary of State, quite rightly, we praised the South African doctor, but she saw her patient face to face. Could I ask the Secretary of State what advice, guidance or instruction he's going to give to the GPs? I know my constituents in Walsall South are keen to see their GPs face to face, but this may be more effective than test and trace.
Tuesday.
Mr. Speaker, the honourable lady is an important question, and one thing we are doing at this point is updating guidance throughout the NHS, including primary care.
Thank
you very much, Mr. Speaker. In his statement, the Secretary of State said that the legislation that he's laid before the House, which incidentally isn't yet available on the legislation.gov website for members to study, he said close contacts of anyone who tests positive with a suspected case of Omicron must self-isolate for 10 days regardless of whether they've been vaccinated. Can I just confirm with him, first of all, that is what is in the regulations, and secondly, for the benefit of the House, could he set out what he set out yesterday in the television studios, the mechanism by which the Omicron variant will be identified and communicated to those people contacted by test and trace, so that we all know how this is going to work, as it's more complicated than the system we've had to date?
Secretary of State.
Yeah, what I can tell my right honourable friend is that what I can confirm is that the new regulation on close contact will be anyone that is a close contact of someone that is a confirmed positive case of suspected Omicron. The UKHSA is working at speed about what are the best ways to determine a suspected case. One of the ways to do that is to do the so-called S-gene dropout test, but there are other quick ways to ascertain that as well. And the work in terms of tracing will be carried out by UK Test and Trace.
Daisy Cooper.
Thank you, Mr. Speaker. It's often said that how a society treats its most vulnerable is a measure of its humanity. And yet a quarter of the clinically extremely vulnerable are yet to have their third primary dose because of the confusion that persists between the third primary dose and the booster. 1 in 5 of the clinically extremely vulnerable are still shielding without any government guidance or support. For them, the uncertainty of the new variant is quite frankly terrifying. So will the Secretary of State or one of his ministers please agree to meet with me and patient groups to discuss our 5-point plan on how we can protect the clinically extremely vulnerable this winter?
Secretary of State.
The Vaccines Minister is meeting with patient groups this week, but she would also be happy to meet with the Honourable Lady.
Matt Hancock.
Thank you very much, Mr. Speaker. Can I join others in welcoming the well-judged and rapid action this weekend, and also welcome the acceleration of boosters, including the new provision of a mass vaccination this weekend in Newmarket. And while existing vaccinations, including boosters, are effective against all known major variants before Omicron, can he set out plans for a variant vaccine should it be needed in the worst-case scenario?
So, State.
Can I thank my right honourable friend for his support? When it comes to potentially new vaccines, that is a programme that the UK has been supporting, largely thanks to his efforts when he was in my position. And that work continues. And if it is necessary to procure new vaccines that we believe are safe and effective and will help with this new variant, we will do so.
Cyril.
Thank you, Mr. Speaker. Gordon Brown said yesterday that the Chief Medical Officer urgently needs to teach the Prime Minister some basic medical facts. I'd say that could probably be extended to some of those on the backbenches opposite as well. Meaning, we're not going to stop the threat of variants.
Sorry. Mr Shelbrooke, I thought you might be going on the NATO delegation, and I don't want to that you've missed out on it. Please carry on.
Thank you, Mr. Speaker. We're not going to stop the threat of variants derailing our progress until we vaccinate the world. Our country has enough vaccine to give at least 3 doses to everybody. Yet, of the 100 million doses that were pledged by the Prime Minister to the world's poorest, less than 10% have actually been delivered. So, can the Secretary of State tell us if the PM will meet his ambition to help vaccinate the world by the end of 2021, or is this yet another broken promise with catastrophic consequences?
Secretary of State.
Mr. Speaker, I think I did say earlier, out of the 100 million commitment the UK has made for international donations, over 20 million have already been delivered, and there's another 10 million about to go.
Thank you, Mr. Speaker. The return of PCR testing will be met with some apprehension by the international travel sector, which has just been getting back onto its feet. But they will at least be cheered by the Secretary of State's statement that we won't keep measures in place for a day longer than is necessary. Can I ask the Secretary of State to ensure that the providers of PCR tests are those that will actually give accurate, good value testing back to the public, and we will not see some of the issues that arose over the summer repeat themselves?
So State.
Mr. Speaker, my honourable friend makes a very important point. I know he rightly takes a close interest in this, and we do want to minimise any impact on our excellent transport and travel sector. And he's right to raise the importance of making sure that PCR tests are available, the pricing is correct, and that the government website where they're listed is properly monitored, so if anyone who breaks the rules is delisted.
Barbara Keeler.
Thank you, Mr. Speaker. Although the measures taken so far are welcome, now that we have community transmission of Omicron in Brentwood and in Scotland, we need more protective interventions. Mask wearing can obviously play an important part, so can the Secretary of State say whether he agrees with the call from the BMA to extend this to all indoor and closed settings? And will he also consider measures to increase ventilation in enclosed settings, encourage working from home, and give proper sick pay for those who need to isolate?
Secretary of State.
I think, Mr. Speaker, we've been clear about why we have set out the new rules on masks. I think our response is the proportionate one. When it comes to ventilation, the Honourable Lady is right to raise the importance of that. That's why it's very clear in guidelines, and many places are following that. And when it comes to sick pay, it's right that we've kept rules in place that allow people, should they be tested positive or have to self-isolate, that they can claim sick pay from day one.
Teresa Villiers.
If the situation deteriorates, and we all hope it won't, but if it does, please can the government do everything possible not to shut down the hospitality and events sector again? Millions of people have their livelihoods depend on this. They're just getting back on their feet. Please let us not knock them down again.
Tuesday.
Mr. Speaker, I agree absolutely with my right honourable friend.
Neil Hamby.
Thank you, Mr. Speaker. The emergence of Omicron is not really much of a surprise. It's more a case of when, not if. And anecdotal evidence from South Africa suggests that whilst it may be more infectious, the potency does seem to be more limited. The particular concern is the mutations to the spike protein in 2 specific areas, and I just wonder what action the government are taking to put additional resources into adjuvant therapy development, particularly given the impact on monoclonal antibody therapies and the vaccine, and what is the status of genomic surveillance in the UK at present?
Tuesday.
Mr. Speaker, first I think it's fair to say that our genomic surveillance has never been so strong. And it was getting stronger even before the pandemic, but because of the pandemic, there's been a huge amount of investment and it's paid off UK-wide. In terms of the treatments, there is some concern around this new variant and Ronapreve, which is one of the key monoclonal antibodies that we use for treatment, but it is just concern at this point. There's no particular evidence. But part of the reason for taking these measures is to buy the time that we need, the 2 weeks or so, 2-3 weeks to give our scientists time to assess the risk of this variant properly.
Mr. Graham-Brady.
Thank you, Mr. Speaker. What assessment has the Secretary of State made of those early reports from South Africa that the variant may actually lead to less severe illness than the previous variants? And secondly, can I welcome the fact we have both a debate and a vote tomorrow on these regulations, but wouldn't it be better if we had the debate and the vote before the restrictions come into force rather than after?
You would think.
Can I tell Mr. Speaker, in response to my right honourable friend, in terms of the debate and the vote tomorrow, I believe the leader will be making a statement on that shortly, I think right after my statement. In terms of the severity, there are reports, as my right honourable friend has referred to, that it is early days in terms of those reports, and we are looking into those and talking actually with our South African friends and getting more details. I think it is worth pointing out that the age profile, the demographics in South Africa is generally people on average are younger, and we are taking that into account as well.
Marshall.
Thank you, Mr. Speaker. The Secretary of State has set out in his statement this afternoon about the booster programme for the vaccines, but he hasn't mentioned what steps he is going to be taking to support those areas where take-up of the vaccine is still very low. So can he now set out what additional resources will be provided to those areas where we know that the take-up of the vaccine is still very low?
It's an important point, Mr. Speaker. The Honourable Lady is right to raise it. There are still, we estimate, around 5 million people across the UK that have not even taken up the offer of their first dose of the vaccine, putting themselves and their loved ones at great risk. In terms of action, there's a lot of work that's been done over the last few months. It is bearing result. We are seeing more and more people come forward, especially in the last few weeks, and indeed we saw many come forward this weekend, perhaps out of concern of this new variant. But there's a lot of work being done with community leaders. There's been an existing communications campaign, but there's a new one about to start imminently.
So Desmond Swain.
Over the last few months, there's been a useful control experiment on face coverings, given the different policies pursued in Scotland and England. What estimate has he made of the result? It's mumbo-jumbo, isn't it?
So State.
I think if my right honourable friend is suggesting that there are mixed views on the efficacy of face coverings in helping to fight this pandemic, he would be right. But I would point him to work that's already set out by UKHSA. I think it was published, if I remember correctly, last month, where they refer to a number of reports where they set out in certain settings how face coverings could help.
Catherine West.
Speaker, what urgent action is being taken to vaccinate people who are bedbound?
So State.
For Mr. Speaker, for such individuals, they're bedbound, homebound, or vulnerable for other reasons and can't make it to vaccination centres, those vaccinations are primarily carried out by GPs. I don't have the numbers of how many have actually been done, but recently, to encourage more people to be done more quickly, we did change the payment system for GPs, and that seems to have helped as well.
Aaron Bell.
Thank you, Mr. Speaker. The opposition often call for more restrictions, but it was the relaxation of restrictions in the summer that this government took under scientific advice that has put Britain in a good position prior to the arrival of this variant. So while I welcome the statement and the precautionary and proportionate measures he's taken today, will the Secretary of State assure me and the House that this is a temporary measure, and when we get more information, when we've bought more time, we will get new measures to react to that information?
So State.
Yes, I'm very happy to give that assurance to my honourable friend. He's absolutely right, and this is all about buying a bit of time so our scientists get the time that they need to properly assess this variant and determine what it really is. Should we really be worried about it or not? But he's also right, Mr. Speaker, to point out that we did take measures in the summer where we set out that we were removing almost all domestic rules and controls. They turned out to be absolutely the right measures. There's many of my counterparts in Europe that now they believe that they should have taken a similar route as well. But I do remember they were all opposed by the party opposite.
Vicky Foxcroft.
Thank you, Mr. Speaker. Immunocompromised people continue to be worried. Many still don't know if the vaccine works on them. The Octave study showed that around 150,000 people potentially have reduced or no antibody response. Octave Duo is not due to report until early next year. Will the Secretary of State ensure this population have access to antibody tests, thus allowing them to know their level of protection? And for those with little or no protection, will he ensure that they have the support they need to stay safe?
Yes, of course, Mr. Speaker. We want to make sure that we are helping people that are immunosuppressed in every way that is possible, including access to any tests that might be clinically required. The Honourable Lady may have noted earlier in the JCVI advice that I referred to that there's also a recommendation which we have accepted to say that those that are immunosuppressed that are able to benefit from vaccine to some extent, that they are offered a booster dose on top of the third primary dose, and then also the antivirals are very important for that particular group of vulnerable people, and it's good that the UK has procured them.
Bob Seeley.
Thank you, Mr. Speaker. Will the Secretary of State, on behalf of Government, reassure me that the Foreign Office and the consular service in the Foreign Office will be doing all that it can, because I'm already receiving calls from islanders stuck in Southern Africa who are worried about their ability to get back. Thank you.
Secretary of State.
Yes, Mr. Speaker, I can give my honourable friend that assurance. We have been working closely with colleagues in the Foreign Office, and it will remain vital work so we can help people, UK citizens or Irish citizens that might be stuck aboard to come back.
Interesting. Hilary Benn.
Thank you very much, Mr. Speaker. Given the change to the rules for booster vaccinations announced by the JCVI this afternoon, how long does the Secretary of State think it will be before all the people who've had their first and second jabs come forward and can receive the booster jab from age 18 to age 40, so as much of the population as possible is protected?
Secretary of State.
Mr. Speaker, first, if I could tell the right honourable gentleman that we've already done 17 million, and that is almost one-third of the adult population. It's more than any other country in Europe. But he's right to ask how quickly could we do those that will become newly eligible. If he allows me, I will have to come back to the House and set out details about how we intend to meet this advice. This advice was very quickly received from the JCVI over the weekend. They did stellar work to turn it around so quickly, but I have already asked the NHS about operationalising it, and we're not quite there yet, but we will be very shortly, and I will set that out.
Richard Drax.
Thank you, Mr. Speaker. None of us underplayed the threat of any new variant, and as my right honourable friend said today, COVID is not going to go away. It's not. It's here for the rest of our lives. The country is learning to live with this disease now. It is the only way forward. Can he please reassure me, the House and the country, that he will never, ever go back to locking this country down?
Mr. Speaker, I mean, no one wants to see those kind of measures, but the honourable gentleman, I'm sure, will agree with me that, well, first let me agree with him that COVID is with us to stay, and we need to learn to live with it. And the best way I think we can do that is with the primary form of defence that we've got, which is our vaccination programme. And I hope he agrees with me. We're absolutely right to basically put the booster programme on steroids, because that will really help us.
Peter Kyle.
Thank you, Mr. Speaker. One of the most COVID vulnerable settings in the country is school classrooms. And children have a much, much lower vaccination rate than adults. And children come from all over communities to one place and then return in the afternoon to families. Now, masks are being returned to corridors, but they're not being returned to classrooms. I take no pleasure in advising the Secretary of State to make children wear masks in classrooms. However, it is absolutely clear what the stakes are going to be if we get this wrong. Students have already been absent from schools by their hundreds of thousands this term, and we are approaching the exam season. If we just act cautiously in the next few days, exams will be able to be sat as normal. If we get this wrong, exams will be wrecked for the third year running, and that will play havoc with their futures, and it will play havoc with teachers and their ability to get the job done on behalf of our country.
Mr. Speaker, the honourable gentleman will know that the Education Department has set out today fresh guidance on masks in communal areas, not in classrooms. I think that is the right approach that the government has set out. And but in terms of protecting children from this pandemic, the vaccination programme of children is important, especially secondary school children, 12 to 15-year-olds. It's I think around over 40% have been vaccinated. It has certainly increased since we opened up the national booking system to that cohort, and I think for 16, 17-year-olds it's almost 60% now, but we continue to work on it.
Andrew Bridgen.
Speaker. My right honourable friend has outlined the government response to the emergence of the Omicron variant and the restrictions that he wishes to place on the public. This House will quite rightly have a vote on these measures. He's also stated that these measures will be reviewed in 3 weeks' time. He knows that in 3 weeks' time this House will be in recess. How will there be a parliamentary scrutiny of the government's review measures, or will we be having government by diktat?
Well, Mr. Speaker, I think that the review should take place as soon as possible, and that is how the government determined it's 3 weeks. And unless Parliament was called back from recess, or the government took longer than 3 weeks, there's no way. I think the approach the government has set out is the right one.
Lucas.
Thank you very much, Mr. Speaker. The Secretary of State says that rich countries must do everything they can to ensure more vaccines reach the global south. Judging by his actions, he means doing everything except the main thing they're actually asking for, which is the waiving of intellectual property rules at the World Trade Organization so that they can manufacture vaccines themselves. This is about justice, not about charity. So will he admit that his government's failure to work with the vast majority of countries in the world, including the United States, who do support a TRIPS waiver at the WTO, is endangering us all? And when will he start putting the need to end this pandemic in front of the financial interests of Big Pharma?
Mr. Speaker, I've heard what the Honourable Lady had to say, but the UK does not believe that waiving patent rights, the intellectual property rights, to those that, on these vaccines would be helpful. It would certainly mean that in the future there will be a huge disincentive for vaccine companies, pharmaceutical companies to come forward and help the world with their technology.
Sir Charles Walker.
I say to the Secretary of State, injecting people, not just in this country, but around the world, is a huge logistical undertaking. I believe in India they use nasal vaccines for the administration of the flu vaccine. Please, can the government bring forward nasal vaccines? We did it in 9 months for an injectable vaccine, March 2020 to December 2020. It's now nearly December 21 and still no nasal vaccine, despite in trials high levels of efficacy being proven.
Mr. Speaker, my honourable friend is right to raise the importance of vaccine delivery mechanisms, and I believe if there was an approved nasal vaccine delivery mechanism, that it would be helpful. But he will understand we do have to allow the regulators the time to assess new delivery mechanisms, but we do take this very seriously.
Debbie Abrahams.
Thank you, Mr. Speaker. And I wholeheartedly agree that no one is safe until we are all safe. And I think the UK and other G7 countries need to take some responsibility for the emergence of this variant. But I just wanted to touch on the fact we already have community spread of this variant. And if we're going to contain that, we must ensure that contact tracing is relevant and is widespread as possible. So can the Secretary of State, I've asked him this in the last few weeks, confirm that the Containment Outbreak Management Fund will be extended beyond March, and for those places that don't have it, that they will have it, and of course those that have already spent it will be able to be properly resourced. Thank you.
The Honourable Lady makes an important point about contact tracing. In terms of the Containment Management Outbreak Fund, especially given the emergence of this variant, we are actively reviewing it.
Steve Bryan. Very much, sir. I welcome the widening of the booster programme that he's announced, but my constituents still have to have no walk-in access
in Winchester. So I'd really appreciate his help with that on behalf of an increasing number of constituents contacting me. Now, the measures that will be asked to approve tomorrow night will likely appear rather small in and of themselves, but he knows the wider impact of the past few days is absolutely huge. You know, we've got nativity plays cancelled or moved online. These are moments that we just don't get back, and community events being cancelled just in case. So the Prime Minister said this lunchtime, if you're boosted, we know your response to this variant is strong. So can I ask my right honourable friend what evidence base this is drawn from, and when we might reasonably expect data from the scientists on how, if at all, the variant hits vaccine efficacy?
First of all, I noted what my honourable friend said, Mr. Speaker, about walk-in access in Hampshire, so I will take that away and get back to him. Secondly, in terms of, he's also right to talk about the impact of these measures. Although, as I said, I believe they are right and proportionate and balanced, we must never forget the impact they have on individuals and their daily lives, and that is why they must be removed the moment it is safe to remove them. And in terms of when we will have more data, the reason we said a 3-week review point is that is the time that we believe that we will have more information, not just the information we come up with ourselves, but through our international counterparts.
Thank you, Mr. Speaker. First of all, can I thank the Secretary of State and his team for all they do to combat COVID-19 diseases in the UK. It has an effect upon Northern Ireland. The Northern Ireland Health Minister just yesterday said that they will follow in Northern Ireland the guidance that comes from Westminster. With that in mind, having heard a leading Northern Ireland scientist this week say that he believes the current vaccination and booster rollout will have an effect on the new variant, could the Secretary of State assure us that any and all curtailments, such as those faced by the travel industry currently, will be proportionate and scientific, taking into account transmission and the seriousness of the new COVID vaccine variation? Thank you.
Yes, Mr. Speaker, I can give the honourable gentleman that assurance.
Dr. Julian Lewis.
Thank you, Mr. Speaker. As someone who very thankfully received his booster jab last Thursday at the outstanding St Thomas's Hospital, can I ask him why it is that certain groups and communities seem to fear vaccination? Which are these groups and communities, and what can be done to persuade them that they're wrong?
Mr. Speaker, I can tell my right honourable friend that there are many communities where vaccine take-up is lower than others. It has been particularly the case in the Black African community in Britain and also some other black minority ethnic communities. It has improved significantly over the last 2 to 3 months. And it is something that is also the case in many of the European countries and indeed the US. In terms of what's being done is a huge amount of work through community leaders and through a communications campaign, and also by offering access in many different ways as possible to the vaccine to encourage take-up.
Andrew Gwynn.
Thank you. Can the Secretary of State talk a bit more about the transmissibility of the Omicron variant and the efficacy of vaccines to it, given Australia has some of the toughest entry requirements of any country in the world, and yet this variant has basically got through a concrete wall?
It's an important point, Mr. Speaker, by the honourable gentleman, is that I think it's fair to say we don't know enough yet. I don't think Australia does, we do, or any other country for that matter. But we do know enough to justify the action that's been taken. And from that, there is emerging evidence that it is more transmissible, but I don't think we can describe it as conclusive at this point. And in terms of efficacy, I would just point to the point I made earlier to my honourable friend about taking the time to determine the efficacy.
Jason McCartney.
Thank you, Mr. Speaker. I welcome the speedy and decisive action taken by the government over the weekend in response to this new variant. I also welcome the delivery of 17.5 million boosters. And will the Secretary of State join me in thanking not only my pharmacy-led vaccination centres, where I had my first and second doses of AZ, but also my GP-led clinics, where I had my Pfizer booster, And is he confident that that infrastructure is in place and also the robust supply of vaccines as we try and deliver 6 million more booster vaccines over the next 3 weeks?
Mr. Speaker, first of all, when it comes to supply, we're very confident about the supply that we have, including accommodating the new advice that I've accepted from JCVI. And I would join him in thanking the many thousands of GPs across the country that have been crucial to our vaccine programme. Mr. Speaker, can I just take a moment to my right honourable friend, the member for Forest Dean, earlier asked me about the regulations and the timing of the laying of the regulations. And I want to clarify that there are regulations for these new measures. They have been made by my honourable friend, the Minister for Public Health and Vaccines, and they are in the process of being registered with the National Archives, and then they will be laid before Parliament, and they should be available to review online at around 5 p.m.
Chris Bryant. Thank you, Mr. Speaker. It doesn't feel like this pandemic is going to be over anytime soon. I mean, we've only got to Omicron, not to Omega so far. Can I urge the Secretary of State to look at two particular things? The first is the campaign of disinformation, deliberate campaign of disinformation that is going on around the country. Some of these people are dangerous. Their views are certainly dangerous, and I hope that he will work with the Home Secretary to make sure that we check on all of these campaigns around the new Nuremberg laws, that nobody is going to be doing damage to people who are working in the health service. And secondly, can he tackle the problem of profiteering? Because frankly, some of the companies are charging completely disproportionate prices now for PCR tests. There should surely be a fixed price across the whole of the UK.
Mr. Speaker, the honourable gentleman is a very good point about the danger of disinformation, how it's actually costing lives, not just here in the UK, but across the world. And he will know, for example, we've talked today a lot about South Africa, rightly, but there's a very low vaccine take-up in South Africa, even when they are available, partly due to this disinformation campaign. And I can assure we're working across government with the Home Office, with DCMS and others to counter this kind of disinformation as best as we can. And on PCR tests, I refer him to the remarks I made a moment ago.
Thank you, Mr. Speaker. I congratulate my right honourable friend for taking swift and efficient action in relation to the additional protections that are necessary. But as he reviews the wearing of face masks and the additional restrictions is introduced as more data becomes available, will he also consider real-life scenarios? Because as he's heard calls from members opposite about mask wearing and working from home, is he aware that in Wales, mask wearing and working from home has still been in place since the summer, yet infection rates are still much higher?
My right honourable friend is right to raise a difference in terms of the approach that Wales has taken in England. I think, like him, that we have taken the right approach to face masks, but I welcome his support today.
Thank you, Mr. Speaker. My right honourable friend rightly highlights the role that South Africa's excellent testing and analysis system has had in identifying Omicron. It would be perverse if South Africa was treated less favourably as a result of the resources they put into such analyses. So will he go back and look at those countries that are neighbouring red list countries that have much lower testing and analysis levels and see whether travel restrictions might be appropriate for some of those countries in order to keep people in this country safe?
Mr. Speaker, we will keep that under review, but my honourable friend is also right to raise, again, like many members have across the House, the importance of South Africa and how it has handled this in such a professional and exemplary way. And he might reassure him to know that in the G7 meeting I chaired earlier, we all agree unanimously on that and the importance to continue to work and to support with South Africa.
Stephen Kidd. Thank you, Mr. Speaker. We know that if the government just sits back and waits to buy development of new vaccines for new variants, then we'll be left at the back of the queue because industry will always go to the highest bidder, such as the EU or the US. Back in April, Clive Dix, the outgoing head of the Vaccine Task Force, sent the government a specific proposal about a new task force to be set up to fast-track the development of new vaccines for new variants. Yesterday, Mr. Dix revealed that the government's completely failed to respond to his proposal. Can the Secretary of State explain why the government's chosen to ignore Mr Dix's expert advice?
So State.
Mr Speaker, I don't think it would be correct to say the government has ignored the advice that the Honourable Gentleman has referred to, and also I think it would be incorrect for him to or to refer to or to say that the government has somehow, when it comes to vaccines, I think he said it's sit back and wait. You know, I just mentioned earlier the huge expansion in the vaccine programme on the back of the advice from the JCVI, and the fact that the UK has the supply already to meet that. The reason that we have that is because we have a fantastic vaccine task force, better than any other country in the world.
Tricia Gibbs.
Mr Speaker, most countries in Africa missed the World Health Organisation target for a mere 10% of their populations to be vaccinated by the end of last month, as they struggle to secure supplies of vaccine. As the Secretary of State heard today, no one is safe until everyone is safe. What more will his government do with international partners to ramp up the sharing of vaccines with the developing countries to lessen the risk of further variant emergence? And what support can be given to developing countries to tackle the mistrust among some sectors of these populations towards the vaccine?
So State.
Mr Speaker, in the G7 call I had today, we all agreed, all members, about the importance of this issue, working with developing countries, with not just providing the vaccine, but I hope the Honourable Lady would agree, looking at what more can be done in actual, once the country has the vaccine, delivering it locally, whether it's local logistics or other delivery mechanisms, and we will be working hard to see what more we can do together.
Robert Health.
Thank you, Mr Speaker. Can I just ask my right honourable friend, I thank for what he is doing, but given that, as I understand it, that children are very little risk from this new variant, so can I just ask him to confirm that the schools will not be closed any earlier than in the run-up to the Christmas holidays? And if I could just ask him about the mask policy, can he explain, given that masks aren't required for offices, can he explain the scientific evidence in which the decision was made to ask students to wear masks in corridors?
So State.
Mr Speaker, I mean, first of all, when it comes to the risk to children from COVID in general, it is a lot less, thankfully, than it is to adults. With regard to this specific new variant, we just don't know enough about it yet to talk specifically about potential impact on children. There are no plans that I am aware of that would require us to close schools early. I think that would be very detrimental to the education of children. And in terms of rules around masks, then my right honourable friend will know that the rules that have been set out today by the Department for Education are guidance for schools in communal areas, and it's something in terms of evidence that the Department of Education will be able to provide with more information on.
Thank
you, Mr Speaker. If we're to win this fight against the Omicron variant, then it's absolutely essential that people comply with public health guidance. But with the UK statutory sick pay ranking amongst the lowest in Europe, there are far too many people in this country who simply cannot afford to self-isolate. Will the Secretary of State commit to working with colleagues in the Cabinet to raise the rate of sick pay to at least the equivalent of a week's living wage, so that no one is forced to choose between the right thing and heating their homes at Christmas?
So State.
Mr Speaker, the Honourable Gentleman will know that we have kept rules in place that will allow people to claim sick pay from day one. In terms of whether further support is needed, we keep that under review and will provide further support if it was necessary.
Stephen Metcalfe.
Thank you, Mr Speaker. Can I thank my right honourable friend for the work he's been doing and the speed with which he's been doing it. However, can he confirm to my constituents that as soon as more is known about this new variant, and if it is deemed to be less of a threat than first thought, as is starting to emerge from the evidence from South Africa and the people who first identified it, that he will act swiftly to remove restrictions, particularly the one around self-isolation, regardless of vaccine status, particularly in the run-up to Christmas?
So State.
Yes, Mr Speaker, I can give my honourable friend that assurance.
Dame Diana Johnson.
Thank you, Mr Speaker. I wondered if the Secretary of State could tell us his opinion on whether every member of this House in the chamber should be wearing a mask.
So State.
Mr Speaker, all members of this House know what the guidance is, and it's a decision for them.
James Sunderland.
Mr. Speaker, like many in this place, I welcome the statement today, and I agree that further measures and restrictions would only be a necessary evil. Could I please ask the Secretary of State to acknowledge the many millions of people and businesses right across the UK who are clawing back their jobs, their livelihoods and their freedoms after a difficult 2 years? And does he agree that these further restrictions should only be an absolute last resort?
Yes, Mr. Speaker, I do agree with my honourable friend, and we all know from our experience with this pandemic thus far that the restrictions, whilst many of them may well be necessary to fight COVID, they do have other impacts, especially on the economy, the life chances of people, on child's education, social life, and also I'm very much aware of the impact that it's had on non-COVID health outcomes. So I very much agree with what my honourable friend has said.
Matt Rodder.
Thank you, Mr. Speaker. I would like to welcome the government's plans to extend the vaccination programme. However, with our NHS under severe pressure after 2 very difficult years, what extra resources is the Secretary of State willing to put forward to support our frontline NHS, particularly our GPs, the ambulance services and A&E?
Mr. Speaker, we have provided just this year alone an additional £34 billion of support to the NHS and the social care system. And each of the areas the honourable gentleman just mentioned, whether it's the GPs through the Winter Access Fund, the support to ambulance trusts, I think over £55 million for the winter pressures, all that extra funding is in place and it's making a real difference.
Jane Hunt.
Thank you very much, Mr. Speaker. She's sympathising with her mask. Having received my booster vaccination yesterday, I would like to thank Leicestershire and Rutland Vaccination Service, and particularly Rachel and Abby, for their excellent work. Would my right honourable friend agree with me that it is vital that constituents take up their vaccinations, including the booster, to help us all through the winter period?
Yes, I do, Mr. Speaker. The vaccines remain our primary line of defence. I congratulate her on getting her booster shot yesterday, but I absolutely agree with her wholeheartedly that everyone that is eligible should come forward, protect themselves and protect their loved ones.
Rachel Maskell.
Thank you, Mr. Speaker. Without in-country manufacturing of the vaccine in the global south, we will never get the protection we need against this pandemic. And supplies, no matter how many donations the government make, will never meet the demand. And therefore, will he again look at the issue about in-country manufacturing, whether that's release of the patent or through other mechanisms, so that we can see a proper scale-up in the global south of the delivery of this vaccine?
I think, Mr. Speaker, the honourable lady is right to talk about the importance of in-country manufacturing in the developing world. She will know, for example, that India is one of the largest manufacturers of vaccines, including COVID-19 vaccine, but she rightly points to that growing and being available to other countries, and is right to look to see how we can support that.
Thank you, Mr. Speaker. I welcome the acceleration of the booster programme, but can I ask the Secretary of State to do all he can to accelerate the approval by the JCVI of the vaccine for under 12s, particularly the clinically extremely vulnerable? I have a constituent who's 7. He's desperate to go to school without fear. All his parents want is to be able to give him the jab.
So State.
My honourable friend is right to raise that. I hope she'll agree with me. The JCVI has acted very quickly since the emergence of this new variant, and if there are other things that can be taken forward to help vaccinate the population, we will certainly be looking at that with great interest.
Steve McKay.
Thank you. I think the Secretary of State briefly mentioned hotel bookings in an answer to a much earlier question, but he'll be aware that over the weekend there were reports of a shortage of quarantine hotel spaces. How's he going to ensure that this doesn't undermine his reasonable attempts at a rapid response to the new variant? And where does someone currently find reliable information about the capacity and availability of such accommodation?
So State.
Mr. Speaker, the department already had contingency plans in place, if countries were rapidly added to the red list. I believe over 600 rooms were made available on the Sunday morning, and that's rapidly going to increase during the next few days. I think it has already increased since then. And in terms of information, it's available, I believe most of it is available on the government website.
Dr. Ben Spencer.
Thank you, Mr. Speaker, and I thank my right honourable friend for his statement. And clearly the problem here is uncertainty. I welcome the analysis and the 3-week review and the ambition to do it sooner, but following on from the question from my honourable friend, the member from North West Leicestershire, if the review takes place after this House has risen, does he agree with me that we should be recalled to debate its findings?
Yeah. So state.
Mr. Speaker, I think that is a decision we will have to make closer to the time.
Liz Twist.
Thank you, Mr. Speaker. With the new restrictions being brought in, it is shop workers and workers on transport services who will bear the brunt of asking people to comply. What measures does the government propose to ensure that those workers get the protection that they deserve?
So state.
Mr. Speaker, these new rules on face coverings, that they will be enforceable by law. The police and other law enforcement authorities will be able to issue penalty notices. I think the penalty starts at £200. I think that should be a last resort, but if necessary, then of course it should be enforced.
Len Saxby.
Mr. Speaker, my North Devon constituents are keen to get boosted with a big queue last night at the Barnstable Leisure Centre vaccination drop-in. But whilst delighted the booster programme is being extended, please can my right honourable friend reassure me that more help will be given to rural constituencies like mine, where residents are struggling to get local appointments despite the hard work of the CCG and vaccination teams.
So state.
First, I'm really pleased to hear that her constituents are so keen, and I can also assure her of that support, especially as we now expand the booster programme on the back of the latest JCVI advice.
Sir Tony Lloyd.
Thank you, Mr. Speaker. The Secretary of State will know very well that the Omicron variation has added alarm to people who are immune compromised, particularly when they're uncertain about the status of whether their third jab was a booster or a specific one for immunocompromised position. There are also people with anomalous positions with respect to the vaccinations. How can, as members of Parliament, we get fast-track information through his department about what is right for individual anomalous constituents?
So state.
Well, Mr. Speaker, most people in that situation, they would be contacted either by letter or directly by their GPs. But I do understand the importance of the question, and the honourable gentleman may have heard earlier that one of the pieces of advice from the JCVI that I've accepted is that those that are severely immunocompromised that have received 3 doses as part of their primary course are also now offered a booster dose as well, so a 4th dose, as long as there's been a 3-month gap since their 3rd dose. In many cases, if an individual is unsure, I think the best place for advice is their own GP. If the honourable gentleman would find it helpful to meet with the Vaccines Minister and get more information, we can set that up as well.
Mr. Shelbrook.
Thank you, Mr. Speaker. May I first of all thank my right honourable friend for his statement today. And could I ask my right honourable friend, he mentioned about reviewing the evidence as quickly as possible. May I ask him, would that include evidence from other countries who have had this variant before it got here? But may I also ask my right honourable friend about flu? Because there's been many health academics who have said that the virulence of flu is growing with the separation that we're doing in wearing masks, etc., and our actual immunity is not tackling flu in the way it used to because we're not mixing. So with the right attention being given to COVID, could I ask my right honourable friend what also is happening looking at other viruses such as the flu, and what plans may in place if a very virulent strain of that may take on?
Yeah, first of all, Mr. Speaker, I can tell my honourable friend that in terms of the work that's being done on this variant, it's being done not just in the UK but by our friends across the world. In fact, in the G7 meeting that I had earlier today, we all agreed to cooperate and share whatever information that we get. And he's also right to raise the importance of the flu vaccine. I'm glad he has, to remind the House that whilst we have been talking understandably about the importance of the COVID vaccine, booster vaccines in particular, clear that the flu vaccine also remains vitally important this winter, and that's one reason why we have the largest flu vaccination programme this country has ever seen.
Very grateful, Mr. Speaker. I'm pleased to hear that there are no plans to close schools, but can I ask what assessment has the government made of the potential for new self-isolation requirements that could keep children out of school, and what steps will be taken to mitigate time out of education, because our children and young people can just not afford to spend any more time away from their educational settings?
Mr. Speaker, we will keep these, of course, these self-isolation requirements, the new requirements, under review. At this point in time, I think very, very few children would be affected, because, as she knows, the new requirements only apply to someone who's a close contact who's tested positive with a suspected case of this new variant. But it is something we will keep under review, and the education of children will always be a huge priority.
Now come to a statement from the Leader of the House. We have a business statement.
Thank you, Mr. Speaker. I should like to make a short business statement following the statement that's just been made by my right honourable friend, the Secretary of State for Health. Tomorrow's business will now be a debate to approve the health protection, coronavirus wearing of face coverings, England regulations 2021, and the health protection, coronavirus restrictions, self-isolation, England Amendment number 4, regulations 2021, followed by Opposition Day, 9th allotted day, Part 1. There will be a debate on a motion in the name of the Scottish National Party. The business for the rest of the week remains unchanged to that previously announced, and I shall make a further business statement in the usual way on Thursday.
I now come to the Shadow Leader of the House.
Thank you, Mr. Speaker, and I thank the Leader for advance sight of his statement on the change of business, and of course we're pleased that this is happening so quickly. The questions that came up in the discussion around the statement that we've just heard show that there are issues which will need to be debated, and scheduling this debate so promptly means that there will be an opportunity for those questions to be made and discussed. There are also questions about the rules on education, which I think I heard the Secretary of State right. There is going to be a statement from the Secretary of State for Education. If not, I think because there are constituents asking questions of members across the House, and certainly that came up in the briefing, I think, on Saturday, which the Secretary of State kindly gave. If it's possible to know, will there be a further briefing on education? Will that be separate from this? And could I also ask, just a very technical thing, how long the Leader is intending to allow for the debate tomorrow, and so that members can sort of be aware of what exactly is the timing that it's likely to happen. Thank you very much, Mr. Speaker.
I'm grateful for the kind words of the Shadow Leader. We gave a commitment to debate matters of national importance as soon as possible, and therefore are delivering on that commitment. The debate tomorrow will be 3 hours, and there will be 3 hours of protected time for the debate in the name of the Scottish National Party. My right honourable friend did refer to education in his comments and the importance of education and protecting children, but I will pass on the Honourable Lady's request for more details to my right honourable friend, the Secretary of State for Education.
First of all, can I thank the Leader for setting out, organising a debate for tomorrow, and for it being 3 hours long rather than the 90 minutes required by statute. I think that's welcome. Can I just press him a little, though, on what the Secretary of State said in his statement? He said, and this was a point raised by my honourable friend for North West Leicestershire and my honourable friend for Runnymede and Weybridge, Secretary of State said that the government would be reviewing all the measures that were set out today after 3 weeks. That takes us to Monday the 20th of December, which is in the recess. Now, I hope that the Secretary of State will be able to allow these measures to lapse. But if he is going to feel that he needs to renew them, or worse, have to bring in stronger measures, can I have a commitment from the Leader that the House will be recalled to debate and vote on measures ahead of them coming into advance? He will know, over the last couple of weeks, particularly due to the way the government handled the standards measures, there has been a diminution in the trust between backbenchers and ministers, and I think giving a clear commitment to treat Parliament seriously would help heal that rift.
What's that? Mr. Speaker, Madam Deputy Speaker, my right honourable friend is, I think, being a little unfair on the government, because he will recall, as he was part of these discussions, as was I and as was the former Secretary of State for Health, in assuring the House that it would get to debate and vote upon important national measures. And bringing forward the debate tomorrow, I think, is a statement of how importantly I personally and others in government take that commitment, that it is only right that this House should approve matters of that kind. There was, of course, a caveat in that agreement, which is that we needed sometimes to act during recesses. Now, actually, mostly that has not, in fact, happened. We've been able to do it when the House has been sitting. But I can't give guarantees as to what will happen in 3 weeks, nor can I give guarantees as to what the desire of the House will be, because it was only Oliver Cromwell who made us sit on Christmas Day.
Owen Thompson. Thank you, Madam Deputy Speaker. And I also thank the Leader for advance sight of his statement, but I'm clearly disappointed that we're losing half of our opposition day, but appreciate the need for bringing forward these pieces of legislation. My question would be why that couldn't have come after we'd had our full opposition day, or given that the government is in charge of the timetabling of business, why they couldn't have found another way that we didn't lose half of our business. So I welcome that we've been given an assurance on protected time, but when will we get the second half of that debate? Will that be Wednesday of this week, perhaps, Madam Deputy Speaker?
Madam Deputy Speaker, I take my responsibility to ensure that oppositions get their opposition days very seriously, and I can give the undertaking that we will try to reschedule the SNP's second half at the earliest opportunity.
John Redwood.
Madam Deputy Speaker, I appreciate prompt debate on the mask wearing and the 3 hours of debate. Will the motion be very specific just to mask wearing, or will we also be able to raise issues like airflow and ultraviolet filtering of air, infection control and treatments, which are also very important in combating the virus?
Madam Deputy Speaker, my right honourable friend is, I think, promoting me to your role to decide what will be orderly to debate tomorrow. But the 3 hours will cover, as I said, wearing of face coverings and the health protection coronavirus restriction self-isolation. I think, though I look with trepidation at the chair in case I'm overruled, that that will allow for quite a wide debate, and I would be surprised if it were interpreted too narrowly.
Indeed. Chris Bryant.
Thank you, Madam Deputy Speaker. The thing is that during COVID, we've started developing really bad habits. Yeah. As I understand it, the measure has not yet been laid. It's not available for any of us to see. It won't be available until later on today. It will start to apply tomorrow morning at 4, and we will then be legislating for it retrospectively tomorrow afternoon. This is not the right way to do legislation. Every single SI that I've been involved in committee corridors in recent months has been retrospective legislation after it has already come into force. This is not the way the House should progress, surely to God.
Hear, hear.
Mr. Speaker, the honourable gentleman's quite long question was, I hope, going to go on slightly longer, because I understand the regulations will be laid by 5 o'clock. So had he gone on for another 3 minutes, they would then have been laid. But I think the honourable gentleman, who's getting a little bit grumpy at the moment, is ignoring the fact that these matters are genuinely urgent. That, of course, it is right that laws should not come in retrospectively in the normal course of events, but our statutes provide for statutory instruments to be brought in and debated subsequently for a very good purpose. And the purpose is that sometimes things need to be done with dispatch. And the dither and delay of the opposition, who would have kept us in lockdown forever, is something that they should remember when asking questions about the speed with which we introduce things.
Bob Seeley.
Thank you very much, Madam Deputy Speaker. Just to follow up the point raised by honourable friend, the member for Forest of Dean, I have a lot of sympathy with what the Leader of the House is saying. We have acted quickly, so we're learning lessons from early in the pandemic, and he is respecting the House by bringing in a 3-hour debate, a very timely debate, as soon as reasonably possible. So actually, he gets brownie points on both those. My question is slightly, though, come 3 weeks,
when we extend, or God help us, not worsen the situation, then we're not going to be able to discuss or do anything on it for at least another 2.5 weeks afterwards, and that is an issue.
Madam Deputy Speaker, I obviously understand that. Christmas comes but once a year, and when it comes it brings a parliamentary recess as well as good cheer. And we have been recalled under certain circumstances, we were last year, but to do it over the Christmas recess is extraordinarily rare, and I think for very good reason. Now, obviously, we all hope that in 3 weeks this will expire. But I can't give any guarantees on that, nor can I give any guarantees on when the decisions will be made in relation to the renewal date. But I will always do my best to facilitate Parliament, but in a way that recognises actually how Parliament wants to be facilitated. I am not convinced that all 650 members want to be back here on the 24th or 25th of December.
Daisy Cooper.
Thank you, Madam Deputy Speaker. Tomorrow we will be debating restrictions which are designed to not just reduce transmission, but I presume also to protect the NHS. I was disappointed that on the 16th of November, a health minister responded to a parliamentary question of mine saying that they had no intention of publishing any assessment of the impact of the current COVID hospitalisations on the availability of NHS beds, staff and elective procedures. So in order for members of this House to have an informed debate tomorrow on the impact of restrictions and whether they are sufficient to protect the NHS this winter, could the Leader of the House please confirm if he will ask the Secretary of State for Health to publish a statement tomorrow morning about the impact of COVID hospitalisations on beds, staff and elective procedures?
Madam Deputy Speaker, I don't want to be unhelpful, but I think that was a question that might have been better asked to the statement by my right honourable friend, who would have been able to give a direct answer. But I would suggest the honourable lady raises it in the debate tomorrow.
Thank you. We now move on to the next item of business. I will delay for a moment to let people leave the chamber quietly and safely with the usual social distancing. Very well done, thank you. Presentation of Bill. Paul Maynard.
House of Lords Elected Senate Bill.
Second reading, what day?
Friday, 14th of January.
Friday, the 14th of January. I have the feeling that the Right Honourable Gentleman for New Forest East might be there on that day. The clerk will now proceed to read the orders of the day.
Leasehold Reform Ground Rent Bill, Lords, second reading.
Now.
I call the Minister, Eddie Hughes, to move second.
Thank you very much, Madam Deputy Speaker. I beg to move that the Leasehold Reform Ground Rent Bill be now read a second time. As honourable members may know, I've long championed a root and branch comprehensive reform of our leasehold system. It's been a long journey to get here, from my private member's bill to try and overhaul the regulations on ground rents. So it is particularly gratifying to be stood here today as the Minister responsible for this hugely important piece of legislation.